Hello and welcome back to another episode of the Smart Start Recreational Therapy Insights YouTube series by Smart CEUs Hub. I'm your host, Nathan Lamaster, and guys, we are on to week number 41. Can you believe it? We are almost there to our 52-week goal. One of these has been posted every single Monday throughout the whole entire year, and we're going to continue till we reach that 52 episode goal. And by the end, you'll have 52 episodes to learn from, to share with your friends, to find out what you don't know, be encouraged, and grow as a recreational therapist. Guys, what you could do if you've been liking this series is hit that like button, hit that subscribe button, and then hit that notification bell so you get notified every single Monday at 7 a.m. Central Time when these new episodes hit, guys. As we grow this channel, more and more recreational therapists will find out about it, and they'll be able to use this information in their practices and in their everyday life as a recreational therapist. So, guys, episode 41. Our topic today is one of the three areas of the leisure ability model, which is the leisure education component. So, we're going to be talking about patient and client education strategies. So recreational therapy doesn't stop when the session ends, does it? Okay. When we teach our clients and their families, we empower them to take it even further, right? Because they're going to be with them after we're gone. Okay. And we're going to break down how to make education not only effective, but engaging and lasting. All right. Without further ado, let's dive on in. All right, so why does client education matter? So education gives clients the tools to continue therapy and what you taught them outside of sessions, okay? They're not going to be with you forever, right? And your goal that you should have for every single client is that they leave better than when they started, right? And that they can continue to grow once they leave your care, okay? Another one would be building independence and confidence. So we're going to help them to feel confident when they're out in the real world, outside of the hospital, outside of the center that we are working with them in, right? So that they can continue to do the things that we taught them in their actual life scenarios, okay? Our education gives them the tools to prevent setbacks and relapses. If they know what to do and they know that they should expect X, Y, Z when they're no longer in your care, because I know, for instance, we talk to somebody who has an addiction, right? Maybe they went through your rehab program and you gave them all these coping skills and stuff during classes, right? But preparing them for what it's going to be like outside, right? And when the craving comes or the stressors come or the triggers of any sort come, right? They need to know what to do and why to do it. And they also need to know that that's expected so that they can, in their mind, know that that's coming up and I already know what to do. Give them that confidence, right? That understanding that I have something in my back pocket if I need it, okay? And we're also going to use education to improve quality of life, okay? So for our recreational therapists, education also strengthens buy-in with the clients, okay? So it shows that you know what you're talking about. It shows the measurable value of our services. So not only are you educating them so they know things, but you're building that trust and that rapport because they know you know things. All right, some common tools for education. There are so many ways to educate clients, caregivers, and families. And I'm going to give you a list of a few different ways that you can do this so that they can take things with them. So one simple one is handouts and worksheets, okay? These are simple, visual. They can be 1 to 2 pages, maybe longer, but put them in color, give diagrams if necessary so they can go back to them when they leave and they can reference what you taught them, okay? Demonstration and practice. Okay, so demonstration. So we retain a little bit of what we read, right? The learning pyramid, more of what we hear, more of what we do, more of what we see, then more of what we are participating in as well, all the way down. So that demonstration and practice at the end is going to help reinforce these things when they leave your care. Okay, so you're going to have them eventually, hopefully, try out what you're teaching them so they're not just learning about it. Okay, digital tools. So that could be another tool that you help clients with. That could be an app, right? Maybe there's an app that's out there that you found really useful. Maybe you create an app that actually helps people and make that into a business. Who knows? Instructional videos, so they can go watch these videos at home, or even short text reminders. So things that can help them stay on track. And you can set that up automatically so you don't have to remember to text them all the time. You can use like a text app that does automation, okay? Or AI. Anyways, so visual aids, okay? Posters. It could be a poster that they print out or they purchase, right? Cue cards, another one. Adaptive instruction charts. So things that show what to do if a certain need is there. Okay, the key is tailoring the format to your client's needs and their learning style, because you're going to get to know them over time. You know what works for them. Maybe even ask them, how do you best learn? And that is the thing that you give to them. And maybe you have a whole toolkit of options ready to go. Okay. All right, let's break down learning styles a little bit more for you. Okay, so everyone learns differently, just like we spoke about. Okay, and I'm going to give you what I think are the best tools that you can use for leisure education after they leave your care or while during your sessions, depending on their learning style. So some people are visual learners. Okay, so in that case, use diagrams, pictures, written guides, those types of things, because that's going to be how they prefer to learn and how they usually retain the best knowledge. Okay, auditory learners like myself. Okay, so I can read a book out loud to you and not be able to understand what I read at all, but if you talk to me and I listen to you, I can usually comprehend almost everything that you speak. Okay, so auditorily, my brain works really well, visually, not so well. Okay, so in that case, you're going to explain verbally. You're going to record instructions. Okay, I had a recording device in school that helped me remember what the lectures were. Thank you, Dr. Pyatt. All right, and encourage repetition. So doing things over and over again, hearing them over and over again, they're going to stick. Okay. Kinesthetic learners. So a lot of people learn best by doing. Okay, so visually or hearing, that doesn't necessarily work for them. They actually have to do the thing to learn, right? They have to have it in their hands, touch it, feel it, do that type of thing. All right, so hands-on practice, actually doing the thing, role playing, actually performing the thing, and interactive activities. So those are the best ways that kinesthetic learners typically learn. So have some of those in your toolkit when you use your education. Okay, so mixed learners. So people that are going to be not just one, but maybe multiple, and that they can learn, which, is going to incorporate more senses in the learning process. So I would arguably say this is going to be better than just doing it based off of, are they visual, are they auditory, are they kinesthetic? Okay, incorporating multiple senses, you're going to have a higher percentage of retention. And so blend those formats of those different things we just talked about. Maybe do some role playing, use some diagrams, and talk about it as you're doing it. That's going to help the client learn the best most of the time. Okay, so and then always confirm, and don't just say yes or no. Don't ask them like, "Did you understand this?" Ask them to explain it back to you. Okay. If they're able to explain it at all to you, that shows that they learned something. Okay. They just say yes. Maybe they're just trying to get you to move on because they're sick of hearing you talk. All right, teaching family and caregivers. All right, so we're not just working with clients, we're also working with their families and caregivers, people that are around them. Okay, and today I'm going to give you some tips on how to best educate these family members and caregivers. Okay, so keep language simple. Okay, they're not doctors a lot of times, they're not nurses, they're not therapists, they are, lay people doing all types of stuff, right? And if you're going to give them education, right, you're not spending a whole session with them teaching about it. You're giving them simplified version. So keep it simple so they know what to say to their loved one or client, right, or caregiver or person that they care for. And don't put any jargon in it. Just let them explain it, and that might trigger what you taught that person so they can show them later. Okay. Provide strategies for managing behaviors. So when this happens, let them know, okay, when this happens, do this. When this happens, do this. And also give them instructions on how to continue what you're doing, simplified, of course, at home. Okay, encourage two-way communication. Give them a way to contact you. Okay, if they have questions, and invite questions and feedback when you're speaking to them. Say, do you have any questions? Are you understanding this? Those types of things. Okay, so your goal there is to be open with them and show them that you're there for them and their client, and they'll feel a lot more confident with your care. Okay, and set realistic expectations so that no one feels overwhelmed. So let's say you did give them a way to contact you afterwards. Let them know that you're going to get back to them as soon as you're able to. Don't expect like an immediate response. A lot of times, kind of set those expectations early, so that they know that if you're not responding immediately, you didn't just forget about them, but also you have a life, you have things you have to do too. Okay, so had to do that with my business, Smart CU's Hub. So, I don't personally answer emails on the weekends anymore, which is great. And I instruct my assistant to not do that as well, so that we can have a work-life balance. Nobody gets burnt out that way. All right, building motivation and engagement. Okay, information is only useful if clients actually use it. Okay, I can tell you all types of stuff. I can give you all types of knowledge, but if you don't use it, it means nothing. That's the difference between knowledge and wisdom, folks. Okay, simple, applied knowledge. Okay, connect education to personal goals with the clients. Celebrate small wins and progress. Involve clients in creating their own education goals so that they have some buy-in with what you're trying to teach them. Most likely they're going to be more motivated by something they came up with and they had buy-in in, right? All right, guys, now for some wrap-ups and takeaways from today. Okay, education is not just extra. It is part of the leisure ability model, right? It is appropriate for clients so that they're not just learning from you when they're seeing you, but they have things that they can incorporate further on as they're no longer in your care. Okay, you're going to use multiple formats for education because people are different types of learners, right? They're visual, they're kinesthetic, they're auditory, sometimes mixed. Okay, you're going to include the caregivers and family members so that they know what to do and how to handle certain situations. And you're going to keep it engaging, simple, and tied to the goals that are for the client so that you can see that progress over time. Okay. All right, guys. Thank you so much for tuning in to episode number 41. I had a blast going over these with you. We're going to be moving on to episode 42 next week, which will be creative problem solving and recreational therapy. So as recreational therapists, we have to be creative. We have to problem solve. Okay. And we're going to be diving further into what that means and how you can use that in your practice. Guys, if you love these videos as much as I love making them for you, please hit that like and that subscribe button and that notification bell. and leave a comment below. Say hi. Tell me about how you do leisure education in your practice. That would be really cool to hear about how you do things, and then maybe I can learn from you. Guys, I hope you have a great Monday. And as always, recreational therapists, remember, stay classy.